AIDS infection and the CD4 count associated. In case of CD4 less than 500, in B. Hensley, there is bacillary angiomatosis, and there is neutrophilic inflammation in biopsy. And C. albicans, there is oral thrush, and on scraping, white plaque and pseudohyphae on microscopy seen. Epstein-Barr virus, there's oral hairy leukoplakia, which is unscrapable white plaque and on the lateral tongue. And HHV8, there is Kaposi sarcoma and lymphocyte infiltration on biopsy. HPV, human papillomavirus, there is squamous cell carcinoma.